I guess, with COVID, what are some trends that you guys, or that you have seen maybe with your specific region, with pharmacists? How are they feeling, or what are their concerns if they come to you with anything?
So, as somebody brought it to you, the pharmacists have been dealing with this for a long time, and COVID just took it to another level. Pharmacists are usually working in a very overwhelming and under pressure condition, just because they're always understaffed, and they're usually one pharmacist who oversees the whole operation. And per pharmacy law, that pharmacist cannot leave the pharmacy or leave their pharmacy environment for any situation as far as going to bathroom, because they have to be overseeing all the pharmacy technician and other staff. That's the law. So that makes it overwhelming. And just in retail, because of big pharmacies, big corporation want to save money, they just put one pharmacist in charge, no matter how many prescriptions they're doing. And that pharmacist is really always overwhelmed, because pharmacists are there for a reason. They're healthcare professional. They're there to check medication profiles, help patients, go over everything that a patient needs. But just because being short staffed and the volume that's incredibly high, they have to do other things such as getting phone calls, getting the register, talking to patient, calling insurance company, calling doctor offices, talking to nurses, going also to the pharmacy and help a patient in the pharmacy. So that's thing on top of everything that a pharmacist is supposed to do as far as going through patient profile, that's just a lot. And since, as I said, a pharmacist has to be there, and pharmacies are usually open for a long period of time, and it's usually 12 hours. Pharmacists usually work 12 plus hours by themselves on their feet with no break. And that makes the job very overwhelming and stressful, because mistake can happen, and humans are humans. If you ask someone to work 12 hours under pressure, mistake can happen because they don't get breaks. They're overwhelmed, they don't have enough help, so mistake happens. And that's what makes this job very stressful and overwhelming. And since COVID started, everything came back to the pharmacy. With every news that break down with a new medication, people call pharmacies, doctors call pharmacies, people show up to the pharmacy. We get new prescription for the medication, for new treatment, and then the vaccination came out, and everything came back to pharmacies. So pharmacists now they have immunization, and now they have COVID screening, and they have more prescription because of COVID, and everything was on top of the already stressful and overwhelming pharmacy environment for that pharmacist. Now they have to do vaccination, they have to do COVID screening, now they have to go through new treatment guidelines for the COVID, and they got no help, they got no extra staff, they got no reimbursement for everything they did. So it's just over and over adding extra work to the pharmacist workload without any reimbursement, without any help, without any extra precaution, that they're working long hours with no break and no help. And that just makes a lot of pharmacists to the point that they quit their jobs, and they feel that's just not only they're tired, but they feel unsafe for their patient. They feel this is somebody's mom, this is somebody's dad, this is somebody's kid. And when I'm not 100% and I don't have time to look at their profile, go through their medication history, they don't have time to go through their immunization questionnaire, just because I'm the only one here and there is so many things I need to do and I'm tired, and I don't think that's safe for my patient to for me to work on their profile, because I'm just not 100%, and it's not safe for my patient. They think they're going to make mistake. And unfortunately, in the pharmacy world, a pharmacist mistake can cause somebody's life, can cause hospitalization, can cause unwanted side effects. So that's something that pharmacists are dealing with it every day. I lost your voice again, Dahlia.
I'm sorry, I was muted. I forgot
yes.
to myself, but
That's fine.
Have more people become pharmacists during this time, or is this something that is the burnout causing people to leave the profession?
Well, so that's a good question. Another problem that the state of Georgia has is that we in the past, when I went to pharmacy school, we only had a couple. Um, and then they just started new pharmacy school in the state of Georgia, and we have more graduates and we don't have that many jobs. And that's because not that we don't have jobs, it's because big companies try to condense all the jobs into one pharmacist, lay out pharmacists that just give more responsibility to one pharmacist that makes the job very stressful. And that's one part that we have too many graduates for one state. We don't have the job demand here. But at the same time, when COVID hits, even before COVID, the job is so stressful and overwhelming that people just leave. And as I said, that's not mostly because they are tired. It's mostly because they feel like they're putting their patient at danger. Because when they bring the concern, it's not the first time that a pharmacist brings this concern up that this is not safe, they're overwhelmed, we are burned out. Even before COVID, we had this discussion. It comes up, people like you just do stories and for once and twice, and it goes back to what it was. Big companies, they don't care, they just keep doing what they want. They just count number of prescription, the money they make, and they don't hear what pharmacists need. And that's a reason when pharmacists feel like they're not heard, when they feel like their environment is not safe for work, they feel like they're going to lose their license, they feel like they're going to cost somebody's life, they think that it's just easier to just quit their job. And yes, before COVID, we had this problem, especially in retail. People just try to get out of retail because it's just very, very, very overwhelming and stressful. And just being on your feet for 12 hours and doing it the next day. And when you don't have help, that's enough. That's by itself, it's enough for somebody to quit their job. But on top of that, just adding things for COVID, people with other jobs already burnt out just because of COVID. And pharmacists have that in their personal life with their family. On top of that, every day is something new with COVID. And you just go to work one day and they're like, oh, by the way, we're adding this and this and this to your workflow. And you have to do it with whatever staff and whatever hours that you had before we give you this extra task. And that just make everything so unbearable for pharmacists, that they're like the company and the pharmacists, that they don't care about pharmacists. Why would I care about them? And also, why would I care about my patient safety when this company doesn't care about patient safety? So they just say, I'm going to get my license and I don't want to kill someone, so I'm just going to leave.
And I know that you're the president for this specific region. Have have you had a number of people come to you specifically during COVID times and bring to your attention the burnout they're feeling?
Absolutely, absolutely. I have so many pharmacists that, well, first of all, this is their job. They went to school for so many time. They all have doctor of pharmacy degrees and they want to work. They went to school for a reason. They love their patient. They want to help their patient, but at the same time, they don't have a life. And they all come and say, hey, we get this new guidelines every day. We get all these things that we need to do. Every conference call, every news station says, oh, go to pharmacy and get your immunization. We wake up and they say, oh, you have to do this many shots today. We go to work and how I'm supposed to finish everything that I was doing, on top of that, do immunization. Why there's no extra help? If you are expecting pharmacists to do extra work, we need extra help and we need reimbursement. For the whole time of 2 years COVID, pharmacists never had remote work, which everybody else had. During COVID, they were the most exposed people because they're just right there. Everybody can just walk up to the pharmacist, ask them question. There was no PPE when we started COVID, and pharmacists were the only people who are like went to work since day one with no PPEs, with no precaution until we had stock and we could do PPEs. We had shields, but before that, there was nothing. So pharmacists always were in front line doing things that they're everyday doing, plus what they did for COVID. And now they're just done. I have so many pharmacists coming to me, they're like, I just need a new job. I don't care if I'm a pharmacist anymore. Just because I need to make a money, I need a job. And that's why I'm coming to work every day until I find something else, because this is just not what I want to do with my life, because basically I don't have a life anymore.
Thank you, Sharon. And those were really the questions that I wanted to touch on, how that was affecting you guys. I know that this Zoom call can't encompass how big of an issue this is, but is there anything that I didn't ask that you would like to bring up? Maybe something that I forgot to mention that's important?
Well, I think the fact that you're just shining light to this issue, that's very important. Just, I would say, mostly, we just need to let everybody know that pharmacists are the most trusted healthcare worker, because everybody, the first phone call, the first person that the patient go to ask for medical advice is their pharmacies. They're just available, accessible all the time. So they just go to them. And for that, just not getting reimbursed and not getting the help they need. And the fact that the pharmacies are not just tired for themselves, they're just tired for their patients. They're just concerned about their patients. That's the more important issue, because the patient safety here is at risk. And pharmacists know better. They went to school for so many times. They all have their doctorate license. They don't want to lose their license. They don't want to kill someone. They don't want to cause something that's not any going back from it.